You've got your newest member of the family, a running stroller, a dog that keeps looking at you with those puppy dog eyes. How do you know when return to exercise postpartum? Let's find out. Look at how cute he is. Rehab. Welcome back to the channel, Dr. Lyndsay, and today I am joined by my better half, literally. Let me introduce you to Dr. Lyndsay Provencio, my twin sister and doctor of physical therapy. I'm excited to be here and talking with you all about one of my favorite topics, return to exercise postpartum. This can be an intimidating new venture for moms, and many feel confused, anxious, excited, and frustrated when they leave their 6-week postpartum follow-up appointment. So my goal today is to get those questions answered about when to return to exercise postpartum and show you some of my favorite exercises to perform. I get asked about return to exercise postpartum frequently, and I know you do too, Lyndsay, since you're specialized in pelvic health. Before we jump into, though, what we should be doing, can we briefly touch on how the body changes during the time of pregnancy and set realistic expectations and how to do so? Yeah, great point. Something that I try to touch on with all of my mamas is the fact that your body is doing amazing things when creating a human. Things that we are going to notice postpartum are core separation, known clinically as diastasis recti, potentially urinary or fecal incontinence, acutely postpartum, enlarged breasts secondary to breastfeeding, and for some women, feelings of pelvic heaviness or dragging that could be associated with prolapse. Let's not forget that intercourse can also be uncomfortable. This may sound like a daunting list, but it's really meant to bring light to these common signs and symptoms. And real quick, just because they are common during postpartum does not mean that they have to be your new normal. PT can help. Simply incredible. And mom, if you're watching this, which we know you are, I'm not sure how you did it with 2 of us, so we're both going to give you a pat on the back for that one. When it comes to diving back into exercise, common things that women may experience with postpartum exercise include pubic symphysis pain. This is right where that pelvis meets in the pubic area. Notable weakness in the core when getting out of bed or lifting the car seat. Urinary or fecal incontinence with impact or tailbone, sacroiliac joint, or low back pain that makes exercising more uncomfortable than it really should be. Again, these symptoms may be common but do not have to be normal. The more we talk about postpartum, the more educated and prepared we are to return to the activities that we enjoy. Okay, so that leads to the ultimate question. When is it encouraged to begin exercise postpartum? Time out. Can't talk about return to exercise postpartum unless we first chat about what the pelvic floor is and the integral role it plays in exercising. Okay, the pelvic floor. This is an amazing group of muscles that sits in between the 2 pelvic bones and can be visualized as a hammock that works to support the organs of urination, defecation, and sexual function. If that doesn't sound important enough, the pelvic floor also works closely with the hip muscles and the spine and core to create a dynamic yet stable support system. And get this, the diaphragm and pelvic floor work together as a pistoning system to manage increases in intra-abdominal pressure. When all is said and done, the pelvic floor is actively working when we push a stroller, sneeze, lift that car seat, run after our toddler, or even when using the restroom. With vaginal delivery, we have increased pelvic floor muscle mobility as the pelvic floor lengthens and stretches during birth. With a C-section, we need to consider the effect of an abdominal surgery on both the pelvic floor and the integrity of the core muscles. Baby delivery aside, pregnancy within itself can challenge the pelvic floor as the baby grows bigger and bigger, causing increased tension on the pelvic floor, as well as symptoms such as increased urinary frequency and constipation. The pelvic floor is constantly adapting and responding, both during pregnancy, birth, and postpartum. How cool is that? All right. So we've covered a lot about expectations postpartum. Let's break it down and discuss diastasis recti first and some exercises to try. Diastasis recti is the widening of the abdominal muscles during pregnancy due to the stretching and thinning of the linea alba, which is that connection between the left and right side of the rectus abdominis. This is completely normal and needed to make room for the growing baby. So how do we restore the core after pregnancy? As no surprise to anyone, exercise, of course. In one study, it was determined that appropriately guided exercise in both antenatal and postnatal periods can result in great recovery of diastasis recti in the first day and in 8 weeks post-delivery. Exercises specific to the core and breath can help to approximate the separated tissue while also retraining the diaphragm and ribs to move appropriately with the core. If there is any noticeable doming or coning, which is pooching of that tissue at the midline during any of these exercises, stop and retry the exercise again. It's important to work on quality and not quantity with these exercises. Remember, it's a marathon, not a sprint. Now, for the pelvic floor and the diaphragm. As mentioned above, the diaphragm and the pelvic floor work intimately together to control intra-abdominal pressure. When we breathe in and our diaphragm drops, we want our pelvic floor to lengthen and relax. When we breathe out and our diaphragm rises, we want our pelvic floor to contract. This patterning should be very fluid and allow for the pelvic floor to work through both pelvic floor relaxation and contraction. Both pelvic floor relaxation and contraction are so important and needed every day. Many tasks would be extremely difficult if our pelvic floor could not function in both ways. However, sometimes this patterning sequence can become dysfunctional and asynchronous. Luckily, it can quickly be retrained and integrated doing exercises as demonstrated here. These exercises focus on the use of our breath to support the pelvic floor. This translates nicely to exercises and daily activities such as toileting habits, box squats at the gym, jumps at the gym, squats with toddlers or kettlebells, and even painful intercourse. Sky's the limit with these. Okay, so let's hit you with all the major takeaways. Pregnancy is amazing, and the body's ability to respond and adapt both during the pregnancy and in postpartum is beyond impressive. Remember that feelings of core weakness, incontinence, tailbone pain, pubic symphysis pain, pressure and heaviness in the pelvis or low back are commonly experienced postpartum, but they are not normal and don't have to be your new normal. Physical therapy and exercises can help. The pelvic floor, core, and diaphragm all work together. One is not without the other, and we can incorporate breathwork, core, and pelvic floor awareness into functional activities, as well as exercises in the gym. Give it a try with your box jumps the next time you're at the gym. The pelvic floor is designed to both contract and relax. This is important. While pelvic floor contraction may feel most difficult postpartum, we cannot forget the value of pelvic floor relaxation. Muscles should be able to shorten and lengthen under control, and the pelvic floor is no different. Don't forget to take a deep breath and relax every once in a while. Time to get exercising, mamas, with confidence. If you are looking to take the guesswork out of your postpartum recovery, check out our postpartum rehab program through the Prehab app.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.